Hi, my name is Amy McMillan. In order to fully analyze McLaren-Macomb as a whole, I have conducted a SWOT analysis that I'd like to present to you today. For those of you who are not familiar, SWOT is an acronym that stands for Strengths, Weaknesses, Opportunities, and Threats. I will begin by discussing the strengths. McLaren-Macomb offers numerous inviting features, including ratings surpassing expectations within 3 safety indicators. These safety indicators include a minimal number of pressure and bed sores on patients during their hospital stay, a minimal number of catheter-related bloodstream infections, and a minimal number of deep blood clots. An area that McLaren-Macomb prides themselves on is their positive patient ratings, many of the ratings surrounding the comfortable atmosphere and friendliness of the staff. Some of the ratings included: nurses usually take time to communicate well, and doctors usually communicate well with patients. Patients can have a feeling of comfort when walking into McLaren-Macomb, knowing the hospital was awarded America's 100 Best Hospitals in 2015 and awarded Distinguished Hospitals for Clinical Excellence in both 2014 and 15. As a result of in-house training, the hospital can provide a strong area of focus within many departments, including cardiology, oncology, orthopedics, and neuroscience. As with any facility, McLaren-Macomb also faces their own weaknesses. With a rating of worse than expected in 3 safety indicators, there are some areas that could still use some focus. These included an increased rate of post-surgery hip fractures, respiratory failure following surgery, and a high amount of cuts, punctures, perforations, or hemorrhages during any sort of medical care being provided. With these ratings in mind comes along negative patient ratings. These ratings including a delayed response time and an untidy facility. This delayed response time includes a 2-hour and 29-minute wait to be admitted for serious cases, an additional 2-hour and 19-minute wait before being taken to the room. A cause of these ratings is due to the lack of employee involvement and motivation. The lack of motivation within the employees is shown through their performance and affects the care that is given to the patients. There are many opportunities presented through McLaren-Macomb. First and foremost, as baby boomers begin to age, there is an increasing need for medical care. With this increase in care, there is a need to increase capacity in order to accommodate those potential patients. In order to care for this increasing amount of patients, there are 100 medical students training at any given time with in-house trauma surgeons 24 hours a day. All members of this trauma department have met the standards set by the American College of Surgeons. McLaren-Macomb features a doctor's office on wheels, known as the MCG Medical Outreach Clinic, or MOC. MOC provides tools that an average doctor's office would provide, including 2 exam rooms, a reception and charting area, and a counseling area. McLaren-Macomb Family Practice Resident Training Program also uses the MOC as a training site. McLaren-Macomb also takes into account patients who speak foreign languages. Within the MOC, 2 Catholic churches provide bilingual volunteers to help aid in language barriers among patients and physicians. There are threats that McLaren-Macomb must be aware of. There is currently a shortage of physicians and nurses, which results in less than satisfactory care for the patients. Only 63% of patients claim that they would recommend this hospital. Another reason for this low rating may be due to the limitations within the facility. McLaren-Macomb is unable to provide all the areas of focus. Patients are then forced to seek care at other facilities within the area. With the ever-changing technology surrounding medical care, more capita is required than the hospital can generate.